Some interesting facts about high cholesterol in people with type 2 diabetes. Do you know that insulin not only controls glucose metabolism, but it also controls cholesterol metabolism at the level of liver and fatty tissue? Insulin resistance and insulin deficiency in type 2 diabetes, they cause hyperlipidemia or high cholesterol. Hyperlipidemia or high cholesterol can lead to damage to beta cells of pancreas which make insulin. Hello everyone. Today I am going to tell you about the importance and significance of hyperlipidemia or high cholesterol in people with type 2 diabetes. Do you know that more than 90% of people with type 2 diabetes have hyperlipidemia or high cholesterol, but most of them are not aware of it. In this video, I am going to tell you 5 important facts about hyperlipidemia or high cholesterol in people with type 2 diabetes, and I hope this information will help you in understanding about this important problem in a better way. Number 1. Hyperlipidemia or high cholesterol is the most common cause of heart attack, stroke, and peripheral vascular disease, which can lead to gangrene and amputation in people with diabetes. And the main culprit is LDL or bad cholesterol. Number 2. Full lipid profile must be done in all newly diagnosed people with type 2 diabetes, and treatment should be started as soon as possible if it is abnormal. The lipid profile should be repeated 8 to 12 weeks after starting the treatment to see the response and adjust the dose of medications. Once the lipids or cholesterol are under control, repeat lipid profile test once in a year. But if not under control, it should be repeated every 2 to 3 months till the target levels are achieved. Number 3. Hyperlipidemia or high cholesterol in diabetes is characterized by high total cholesterol levels more than 200 mg per deciliter, high triglyceride level more than 150 mg per deciliter, low HDL or high density lipoprotein or good cholesterol which protects your heart, less than 40 mg per deciliter in male and less than 50 mg per deciliter in female. High LDL or low density lipoprotein or bad cholesterol levels more than 100 mg per deciliter. In people with type 2 diabetes, the quality of LDL is really bad, which accelerates atherosclerosis and blockage. High non-HDL levels, which is being calculated by using the formula total cholesterol minus HDL cholesterol. It is useful if the triglyceride levels are more than 400 mg per deciliter, which can falsely lower LDL levels. In this situation, non-HDL cholesterol levels are useful to direct for the treatment. High ApoB levels, some laboratories only they measure it, and it is also considered as bad cholesterol like LDL. Now the fourth and the very important point is that what should be the desired levels or target levels for different types of cholesterols in people with type 2 diabetes. Total cholesterol levels should be kept less than 150 mg per deciliter. Triglycerides levels should also be kept less than 150 mg per deciliter. HDL or good cholesterol or high density lipoprotein levels should be more than 40 mg per deciliter in male and more than 50 mg per deciliter in female. The desired target levels for LDL, non-HDL and ApoB are depicted in this table as per the risk categorization. There are 3 main risk categories in people with type 2 diabetes. Number 1 is extreme or very high risk category where the LDL levels should be less than 55, non-HDL should be less than 90 and ApoB should be less than 70 mg per deciliter. In high risk category, it should be less than 70 mg per deciliter for LDL, less than 100 mg per deciliter for non-HDL and less than 80 mg per deciliter for ApoB. In moderate risk category, the LDL should be less than 100 mg per deciliter, non-HDL less than 130 and ApoB should be less than 90 mg per deciliter. So don't forget to ask your treating doctor about your risk category or your risk level and your desired target levels. Now the fifth and the last point is the management of high cholesterol levels in people with diabetes. The first is mindful and healthy eating, and you can find the link to my video in the description box below. Then second is regular exercise, 45 to 60 minutes per day. Again, you can find the link to this video in the description box. Third, stop smoking. Fourth, statins, which are the most important medications to reduce the cholesterol levels. They reduce the synthesis of cholesterol in liver. Fifth is cholesterol absorption inhibitors, and sixth is non-statin therapy. Cholesterol absorption inhibitors and non-statin therapies are used when the people are not able to tolerate high doses of statins, or people are not getting controlled with statins alone. Always take your cholesterol medicines regularly, as they may be life-saving, and it is safe in most of the people with diabetes. But if you face any problem when you are taking these medications, please ask your treating doctor, and he can make some changes in the dosage, or he can change the medications which can suit you.